Good evening, everyone. Gosh, so nice to see so many of you. Some faces I recognise, some I don't, but a very big thank you for coming to join us here at the beautiful Peak Health Club and Spa. I'm Francesca Oakerman-White and I'm the founder of the Beauty Triangle. So we're here tonight, as you know, to discuss all things hormonal health, because I'm sure we can all agree our hormones affect everything, from how our skin feels to the density of our hair. They control our sleep, our mood, our energy, everything, stress, so much more, and we're going to delve into all of that tonight. But when we established the Beauty Triangle, it was very much to educate and empower audiences on all aspects of their health and well-being, and always from a holistic standpoint. However, it was also our intention to destigmatize some of these taboo conversations that sort of go slightly unaddressed in the world of well-being, whilst also introducing you to the most authoritative voices in the world of wellness. Which brings me very neatly onto our amazing lineup of panelists tonight. We're joined by naturopath, herbalist, and founder of Cloud 12 Lifestyle Club, Jenya Di Pierro. We're joined by aesthetic doctor, founder of Aesthetics Clinic and regenerative expert, Ms. Sherina Balaratnam. And we're also joined by the Peak's head of fitness, Gino Raccuglia, and I hope I've said that correctly. I have, wonderful. And they're here really to help us take back control of our bodily hormones, our bodily chemicals, and I suppose restore a sense of balance, both inside and out, when we feel like things are a little all over the place. Hopefully you'll have found programs on your seats, and there's also a referral card, so if you'd like us to connect you to any of the amazing speakers you hear tonight, you can just leave your email address, tick the box next to their name, and we'll sort all of that. We'll have time for questions at the end, so please save up anything that you hear until then. And we have an amazing goodie bag for all attendees. We have a great victory oil by intimate health and body care brand Nidea, which is really beautiful, so please don't leave without taking one of those with you. I've spoken enough now, and I'm going to pass over to our speakers. They'll say a very quick hello, and then we'll get started with the main conversation. Jenya, maybe you can kick us off.
Thank you. So I'm Jenya Di Pierro, herbalist and naturopath, and I specialize in hormonal health. So I've trained in functional medicine and a variety of different naturopathic modalities. And what I do is do 3-month programs with clients where we go through every aspect of their health, trying to get to the cause of the problem, which in naturopathy is the most important aspect. And as a result, we create dietary plan, herbal and supplement plan, as well as discuss some lifestyle modifications and so on, to give them support from kind of every pillar of wellness and bring their body back to balance.
Amazing, thank you, Jenya. Sherina, oh, sorry, we need to shut the microphone.
Thank you, Jenya. Thank you, Francesca. Good evening, everyone. My name is Ms. Sherina Balaratnam, and I am a former plastic and reconstructive surgeon for the NHS of 12 years, specializing in burns and skin oncology. And what I loved about my class was that it was all about regenerative science, to restore balance and structure and function back to the skin, face, body, and everything. So with that, I looked into something in the future, and I saw a lot of focus being on the long-term gain of the patient and regenerative science. So I came into the field of aesthetic medicine and regenerative science over the last 12 years. So I've been a doctor for almost 26 years. What I love about the field of aesthetic and regenerative medicine is that we're treating the whole human, from skin to face to scalp and body. So I launched my own practice 9 years ago in Buckinghamshire, in a town called Beaconsfield, and that is what we do. We specialize in everything non-invasive, and I'm really excited to be here today with these two esteemed speakers, where we get to share with you how we really link it all together, because it's all about treating the longevity of the patient. Thank you.
Thank you, Sherina. And Gino, over to you.
Hello, my name is Gino Raccuglia. I'm the head of fitness here at Peak. Here in particular, we specialise in mobility of the body, and we also personalise certain programs for any type of client that we encounter. My experience in the fitness industry, I've been in for about 15 years. I basically love trying to help anyone with any type of particular problem that they might have with movement, strength, or postural issues, and I teach them how to move forward and how to improve their livelihood through fitness.
Perfect, thank you. I'm so fascinated to hear what all of you have to say, and I feel like there's already going to be such an amazing link between all of the conversations we'll be having. But we'll start firstly with Jenya, who's already introduced herself to you. I think you have a refreshing approach to hormones, actually, Jenya, and I'm really fascinated to pick your brains about this tonight, because when we talk about hormonal health, it's a very broad term. It covers so many different things. So I'm really interested just to start off by knowing what the most common hormonal conditions or imbalances that you see in terms of the patients that find their way to your door.
So I often see patients where kind of natural medicine traditionally have worked really well at helping them either bring their body back to balance and heal or reverse some of their symptoms. So, and also, of course, the most prevalent conditions when it comes to kind of reproductive age, this would be polycystic ovarian syndrome, endometriosis, infertility or challenge fertility, and then, of course, later on, perimenopause and menopause. And then, there will be a lot of symptoms or conditions that would derive from those imbalances. So when we talk about endometriosis, there might be painful periods or heavy periods, and then anemia and infertility that come from that. When we talk about polycystic ovarian syndrome, which is characterized by this ovarian cysts that can be present or not, but has to do with imbalance of androgen in the body, and that in turn can cause skin issues such as acne or absent periods, and again, absence of ovulation and then infertility. And when we are going more into kind of perimenopause, actually for me it's not a condition, it's just a transition from approximately 40 to 50 years of age where your hormones start fluctuating, and it can cause some uncomfortable symptoms where your estrogen might spike or fall, and then, depending on that, again, you might have painful, heavy, clotty periods, a lot of blood loss, anemia. You might have mood disorders. These are more related to progesterone loss in the body, which is one of the first hormones that starts to decline, and then you might get brain fog and fatigue related to that. And then menopause. And I have to say that none of that has to be uncomfortable. If you maintain your body and you look at these main pillars of health, which are healthy diet, stress reduction, some supplements and herbs, love and care, exercise, rest and sleep, then actually we're supposed to sail through menopause and perimenopause. And there is evidence of that in endogenous societies, for example, where women, sometimes they don't even suffer pain during childbirth.
Really?
Yes.
So,
that's harder to achieve. But essentially, our body is not supposed to suffer. And that's the goal. And not necessarily even to heal the condition, but to give all the framework for it to be well in any area of health.
I mean, it does sound very nuanced, and there are evidently so many different aspects that you might be addressing when it comes to hormonal health. Is there a place that you start? Is there, when a patient sort of presents to you, how do you sort of get onto the skin of what it is that they might be experiencing and help them?
So for a naturopath, actually, we don't need to run tons of tests to understand in the first instance what's going on with the body. And I love functional medicine, I love tests, but they can be pricey, and also, sometimes if you really want to get to the bottom of the issue, you need to run tons and tons of them. They can get a little bit confusing. So I normally start with a big picture. And for a female of reproductive age, it's her period. Like we often say, gut is a barometer of health. For a woman, actually, menstrual cycle is a barometer of health. So what I do with my clients, we do tests that cost nothing, and they have to do with monitoring basal body temperature. And also connected to that. And by the way, if you really want to monitor it, you need to kind of know a few T's and C's, so it's better to talk to a specialist. But you're probably familiar that you need to take temperature first thing in the morning, as close to kind of 8 a.m. or kind of earlier. And you need to be lying down for at least 2 hours, so kind of important for shift workers. So if you get up in the middle of the night, you need to use a thermometer, which has 2 decimals because it's quite precise, and it should be not older than 2 years, and some of them might be imprecise, so you have to kind of swap it. But essentially, you start with monitoring your temperature, and you're kind of looking for spikes, or a spike, where that will signify progesterone rise and ovulation in a female body.
How dramatic when you say spike? Sort of what are you looking for in terms of fluctuation?
So it can be kind of a few decimals. So it's not massive,
but it's
so like
just a noticeable inflection.
Yeah. So essentially, you look for kind of 6 low points and then 3 high points. So because it can be, sometimes you can have a spike because you had a big night out or you've eaten a heavy meal. That also happens. You need to disregard those. But there needs to be a trend, kind of a little bit of a trend of 6 points lower and then 3 points higher, and then kind of if it stays up and your period doesn't start, that would obviously indicate fertility or pregnancy. But what you can also do in addition, you can do a lot of other mini checks. So for example, together with the temperature, you can monitor your cervical mucus, and when it kind of getting close to the ovulation time, it will get thicker, like an egg white consistency, so it can kind of becomes quite stretchy, which actually indicates estrogen rise, so you can understand something about your estrogen levels at that time. And then estrogen would be kind of a trigger for luteinizing hormone, which is the one that kind of triggers the release of the egg.
It's really interesting, all of these sort of silent signs that the body actually has. It's almost like it speaks its own language, and we have to just know how to interpret it.
Absolutely. And then if you want to dig a little further with that, you can actually take a pH strip and test the pH of your mucus. So this is mainly, of course, for women who want to get pregnant. And at that time, pH of your mucus needs to match pH of the sperm. So you can actually check the acidity and pH levels, which will already tell you so much about key hormones such as estrogen, progesterone, whether you're ovulating. And then the timing of your ovulation is also very important. We have 2 phases, follicular and luteal. If your follicular phase is too short, that might be problematic for follicles not to develop to high quality. And then if your luteal phase is too short, that might be problematic for your endometrial lining not to develop to the quality that can sustain pregnancy. So by understanding the number of days, you can also kind of derive whether things are in balance or you need to address that. And the amazing thing about that there is a herb for every one of those issues that I've mentioned.
That's exactly what I was going to ask you. I mean, it sounds so empowering that actually before we even get to your door, we can be assessing and analysing and really observing our bodies and trying to sort of understand a little bit better about what's going on. But when we have identified, or maybe you've helped us identify what the deficiency is, what the excess is, where do herbs and sort of homeopathy, where does that all come into play, and what do you find yourself recommending mainly?
Okay, so it's important to understand where your hormones are, but also it's important to understand the cause of the problem. So if I give you an example of endometriosis, which is probably one of the more complex diseases because it's also kind of considered almost autoimmune type. This is where tissue similar to a uterine lining starts growing outside of your uterus. So you might experience heavy, clotty, and very painful periods, and then kind of
Sorry to interrupt. I was just going to ask how many people you actually see. Sort of, what are the figures? How many of us does that affect?
So approximately 15% of women of reproductive age will have endometriosis. There's also silent endometriosis that some women might not know about. And approximately 15% of women will have polycystic ovarian syndrome. So that's every 3rd woman of reproductive age will have one of these conditions, and they are the 2 most prevalent.
Do you see it becoming wider, sort of spoken about now? I know I was diagnosed with polycystic ovaries when I was in my early 20s, and I saw a gynecologist who essentially said to me, don't worry, you don't need to have a period. When you want to have a baby, we'll put you on some medication and it will all be fine. And it feels like the dialogue and the narrative is very much changing now.
It is, because unfortunately when it comes to many of these conditions, the answer from the conventional medicine is can switch off your hormones, which is not ideal for when you want to come off your pill and you want to get pregnant and restarting the period in some cases is very, very hard, especially if there is some other history, for example, eating disorders and so on. So turning off your hormones for long periods of time, that's not a trivial thing. But when it comes to the endometriosis, what's offered also are very invasive surgeries, which again can be, with a lot of side effects and quite debilitating on the body. And that's why women are looking for some alternative methods of maintaining their health.
And when you say switch off your hormones as well, I assume that covers things like oral contraception.
Yes, exactly. And can be also, women can be put on kind of HRT, which switches off your natural hormonal production. And
you're not against sort of bioidentical hormone, sort of BHRT, but it's more that you find more natural alternative ways to support that balance in the body, is that correct?
I'm actually not against anything because there are cases when women are suffering so much. These conditions can be really debilitating. And the only answer is conventional medicine, which can go kind of much stronger than natural medicine. But I think that where possible, women need to consider natural approach first to see if that will, with endometriosis you can't really kind of get rid of it. It's more kind of reversing the symptoms. And if you can live symptom-free with better habits for nutrition, some herbs with better understanding of your body, isn't it a great thing?
It's about managing it a lot of the time. Now, I interrupted you earlier when you were talking about herbs, so I'd love to know what are the herbs that you are sort of very reliant upon in your practice when it comes to balancing hormones?
Okay, so I'm going to mention kind of a few groups, but actually, interestingly, when it comes to endometriosis, the focus is completely different. It's actually on the gut health, and it's kind of the leaky gut and gut dysbiosis and these type of dysregulations which raise inflammation in the body and in the end kind of cause that. And also liver. Liver is such an important organ to look after if you want to balance your hormones, because it's a clearing organ for hormonal excess. So if liver is not functioning optimally, and sometimes there are some genetic defects that can be responsible for that, so you might end up with too much estrogen in your body because liver is not clearing it fast enough. And also, of course, we've got our xenoestrogens, which are kind of these environmental toxins from plastics and other exposures that come into our body. So there are a lot of factors that contribute to estrogen excess, which is at the core of the problem with endometriosis. But more specifically with hormones, what I would do in the case of endometriosis, I would use herbs called phytoestrogens. So it's very interesting because phytoestrogens are the herbs that can be used when you have either excess of estrogen in the body or deficiency. And herbs are very clever like that. They sometimes don't upregulate or downregulate. They kind of get into your body and do what it needs. And just to explain very quickly how it works, when we have estrogen excess, so we have too much estrogen and kind of toxic types of estrogen. There are different types, some are more problematic than others. When we have all of them in circulation and phytoestrogens come in, they bind to receptors and they compete with those toxic ones. They kind of keep them away, and overall exposure inside the cell to estrogen drops. And then, of course, in menopause, when we don't have enough estrogen in the body, then this phytoestrogen bind to receptors and they raise level of estrogen. So these are great for kind of estrogen excess or estrogen deficiency in the body. And then there are herbs that work with androgen excess, so polycystic ovarian syndrome, acne, facial hair loss. So there are also toxic type of androgens, and there are herbs that stop sort of this toxic conversion. One of them is saw palmetto. It's also used in prostate health. And also there are herbs that speed conversion of testosterone to estrogen. It's getting a bit technical, but essentially when we have too much estrogen in the body, and that's one hormone that sort of converts to estrogen via aromatization. So we have herbs that speed up aromatization. So one of those herbs is white peony. So that's kind of number one for polycystic ovarian syndrome. And also you would consider that, if any other symptoms of polycystic ovarian syndrome are present. And licorice is another herb.
Because I feel like we've covered a lot of the physical attributes of the hormonal imbalance, but often when women speak about perimenopausal symptoms, menopausal symptoms, a lot of it is also about the sort of energetic and the emotional things that crop up. So is there anything that you find a very powerful remedy when we're dealing with things like brain fog or stress or inability to sleep, the things that sort of really do seem to bother us on the day-to-day and make us feel less like ourselves?
Yeah, absolutely. There are herbs that deal directly with that. So, for example, Bacopa or Brahmi is the herb that improves your cognitive ability. And also, it happens to be the herb that boosts collagen production in the body. So it
sounds amazing. So brain and collagen.
Yeah, I mean, herbs never do just one thing. So for example, when I give a calming herb for one of those issues, motherwort, it's also a liver herb, so it's slightly bitter. So I would choose it for the client who has liver issues, and then they want a little bit of a calming action. So herbs would often cover 6-7 different systems or organs or actions.
And that's such a nice approach, because you're not just addressing hormonal imbalance or excess or deficiency, you're actually looking at the patient more as a whole, which I think is what we so often talk about, and sort of really helping them in a more holistic way to manage things on the day-to-day.
Yeah, absolutely. And I often talk to patients about the fact that when our body is in kind of lower vibration, so when we feel all of those emotions linked to stress, but also anger, depression, it will really struggle to heal. In order to heal, we need to lift our vibrations. And so I talk a lot about manifestations, and I talk a lot about feeling joy. Manifestations sometimes is not so easy, especially when the person's unwell and they're trying to imagine themselves in really good health, even if they want that state. If there is any kind of grain of doubt in their head, oh, but what if I can't? What if I won't heal? Or what if all these factors are not going to line up? Then manifestation is not going to work. So I often talk to them about getting into this state of joy by doing little things that sometimes seem so insignificant, like, I don't know, going for a beautiful walk in the garden, or playing with your dog, or decorating your house with flowers. But once you get to that state of joy, that's when you create the best environment for your body to heal. That's when all of the cells and the vitality and everything starts working in the right direction. And I know that's a little bit, you have to believe in it, and not a lot of it is scientifically proven, but my background is actually in quant finance before I became a naturopath, so I need to sort of explain everything with my brain, a bit less now, because I also came to realize that most incredible things in life cannot be proven or understood by the brain. But anyhow, so I kind of do a little bit of kind of energy healing with my clients and teach them some of those techniques. But also, if you want to just understand it on a biomedical level, when we're stressed, our body does not produce digestive enzymes. So we're in this fight or flight mode, which means that all of the supplements, lovely food we'll be taking, is not going to be metabolized. If it's not going to be metabolized, you might get an infection and some sort of dysbiosis in your gut. If you get dysbiosis in your gut, you're going to have raised levels of inflammation. If you have endometriosis, that's going to add to already inflammatory profile of your body. So even if you kind of don't believe in the manifestation side of things and the energy, which actually is completely amazing, and I think we all should embrace it, but there are also a lot of biochemical processes in the body that are caused by stress and depression and kind of lower vibrations that we can also explain in the terms of science.
I completely agree with you. I think sometimes it's these little everyday things that we do that bring us joy, like you said, sort of getting out into nature. I think it's so powerful, it can't be underestimated. that actually makes us feel like ourselves again as well. And that's part of the puzzle when it comes to understanding your hormones. You know, we can take the herbs, we can do the BHRT, we can do whatever it is that makes us feel like we're doing something, but we also have to do little things for ourselves every single day, and I think you summarised that very beautifully. Thank you so much, Jenya. That was absolutely fascinating. And I'm sure there'll be lots of questions on everything that you do at the end. Thank you. Our next speaker is Ms. Sherina Balaratnam, founder of Aesthetics in Beaconsfield, regenerative expert, former surgeon. The list goes on. But Sherina, you take a very investigative approach to the patient who sits in front of you, and it's really interesting following on from what Jenya was saying about all of the signs that she looks out for. But when you're looking at a patient and you're looking at their skin and their scalp and their body and their muscles and their bone, is there anything that indicates to you that maybe they need to start, or that you might need to start questioning their hormones?
Absolutely, Francesca. Before I forget, I think there's a few people that might want to know, Jenya, the name of the herb for the brain and the collagen.
Oh yes, that's a great one.
So it's called Bacopa monunieri, and
We'll get her to write
you
it
can
down
email.
for everyone.
But also, so it's a close sister called Centella asiatica. So these are Latin names, but you can also kind of find them by googling Brahmi as a herb and go to Kola. So Brahmi is BRAHMI, and then go to Kola is GOTUKOLA. And they're available in the form of tea, which is really great because it's not even medicine in the sense that you can just enjoy a cup of tea and then heal your skin and enhance your cognitive ability at the same time.
I feel like we need to get that into the goodie bags next time.
The one with the estrogen, plus or less?
Yes, so there would be a few phytoestrogens. The ones that I would use the most is black cohosh and vitex. But then, if you want to take them in the form of tea, it's also sage. Powder is maca, and trifolium, which is red clover, which is a very beautiful, tasty tea if you want to take it in that form.
Thank you, Jenya.
Motherwort. So this is. I'm sorry. Just okay. So motherwort is a calming herb. It's quite bitter, so it will anything bitter will flush your liver, so it will stimulate liver function. So that's a herb that you can take in a tea form, but a lot of the ones that I use that's also good for sleep and kind of more calming effect would be Californian poppy and passion flower. Also Venus straw to remove some anxiety if that's the problem. So motherwort is also more kind of for anxiety. So some of them are more calming and others they're not really sedative, but if you're anxious and that's the reason you can't sleep, then Scutellaria lateriflora skullcap. Sorry, I remember the Latin and don't always remember the common name. Yeah, skullcap is another herb which is really amazing for any types of anxiety.
Brilliant, thank you.
Thank you. Yeah, exactly.
So thank you very much for your question, Francesca. And it's really interesting how you talked about the silent signs of the hormonal disbalance. And more often than not, patients don't actually know that they're experiencing it because they just know that they have the brain fog or they're just not feeling right. They feel like they've just woken up the next day and the collagen has completely fallen off their skin. The faces have dropped. They just know that something's not right. And I'd really like to go from top to toe when someone comes into my consultation suite. And they may be presenting with signs of the skin, but what I'd like to do is actually just look at them whilst we're having a consultation. And I truly believe in a deep and thorough consultation process. There's nothing better than time. And our mission as doctors is to listen. Our mission is to listen.
I've been through your consultation process, so I can actually attest to that. It's but it's important to take that time to get to know the patient.
So I always say look, feel, move, touch, or look, feel, touch, move. That's very, very clear. So when I'm talking to a patient, I literally am looking into their eyes, but I literally am also looking from top. Sorry, I'm looking at you, but I'm looking. She's very beautiful. But I'm looking from top to toe. I'm looking at the top of their heads, I'm looking at how their hair's growing from their parting, I'm looking for dry, brittling, graying, you know, and I'm also looking for thinning. I'm looking for scalp irritation, I'm looking at the color of their scalp, and that could be such a clear indication, especially when we're looking at different age demographics, the 20s, the 30s, the 40s, the 50s, the 60s. A lot of my patients are 78, they're 83 years old coming into the clinic for the first time. So we know that patients are older, but sometimes from 40 to 55, it's very hard to say how old someone actually is because everybody is aging so well nowadays. So I start at the top and I'm starting to see if it all makes sense, especially when I know their date of birth. And then I'm looking at other things, such as, you know, how fine does the hair look as well, because there's different stages of hair aging as well. And I bring up hair aging whilst being a plastic surgeon as well as a cosmetic doctor. Well, and it's not my specialty because it's still part of the human aging. And we really need to embrace everything from top to toe. And then I make my way down. And I'm looking at everything from the skin on the forehead, I'm looking for differences in appearance, I'm looking for pigmentation, I'm looking for facial redness, I'm also looking for fine lines and wrinkles. And with the experience of life, we all have a little bit of extra muscle movement that we also know, and as well as excessive muscle movement. If there's excessive muscle movement, it could be an indicator of soft tissue loss underneath, because don't forget that we can see skin, but there are actually 5 layers of our face. You've got your skin, of which there's layers, and they're aging in different ways. And then there's superficial fat, and we know from cadaveric dissection from the last 20 years that facial fat is also segmented into little pockets. So we don't just kind of go flop all the way down, because superficial fat is segmentalized and it ages in a predictive fashion. So we can look into the future now, we can almost predict how people are going to age because we have the wealth of knowledge from CT and MRI scans and histology and cadaveric dissection, so we can know how that soft tissue is aging. If it's not in keeping with the patient's age, then something else is going on as well, which could be hormonal, and hormonal could be our female hormones, menopause, perimenopause, male menopause. But it also is an indicator of stress-related issues, and women don't often mention that, but we'll come to that later. And then also looking at muscles, and this is really interesting because Gino, you're going to be talking about muscles, but I also talk beyond the body, I talk about facial muscles, because we have muscles of facial expression, which are these, and etc., and these, the neck, but we also have skeletal muscles, very similar to skeletal muscles in the body, and those skeletal muscles are in the jawline, okay? And most of my patients, if you ask my colleague Raccuglia, most of my female patients are grinding. So when we're grinding, we have to then touch and feel because due to excessive tension, excessive stress, frowning at the kids. And we also know that when you tense your jawline, these 2 muscles, your temporal muscle temporalis, as well as your masseter, these are all interconnected underneath the cheekbone. So most patients, when they're grinding, they also have excessive muscle movement here. So guess what? Tension headaches, migraines, and then what do they also get? Grinding of the teeth. So we also look inside the mouth. When I look inside the mouth, and people find that peculiar when I'm doing an aesthetic consultation. Why is she looking in my mouth? She's not a dentist. But it's important because we're treating the whole human again. And when you look inside the mouth, you can see telltale signs of grinding or bruxism because the teeth are starting to sow in. There's also an overbite, which also comes postmenopausally. And the other thing that also happens is sensitivity. You ask the patient, can you feel sensitive? Does it feel really extra cold? Do your teeth not feel right? And they say yes. And you got to think about the reconstruction of that area as well, because in the future it can lead to a problem. So that's the dentition in a separate category altogether. And then we move into the rest of the face, and if everything just looks like it's dropping, then we look at signs of accelerated aging. Now it's really interesting you talked about inflammation. And I talk about inflammation every day in my practice because we have good inflammation, we have bad inflammation. And good inflammation is something that we have when we train, when we bodybuild, we push ourselves through a little bit of stress. But it's when it's overdone, and that's when bad inflammation can take over and cause accelerations in our aging, across the skin, across the face, across the soft tissues, across the facial muscles as well, and then finally to the bone. And we go through osteoporosis in the bone, which is just a natural decay of the skeletal platform. We can look at predictive aging, look into our grandparents, our great-grandparents, and guess what? They're shorter than they were 20 years ago in photos. I look at myself and sometimes I think, why do my shoes not feel like how they did when I bought them 10 years ago? Are my feet getting smaller? I just look at my dog and his face is smaller now than it ever was. So that's a form of osteoporosis. So I have to look at all those features of the face and then come to the skin.
Tell me a little about the skin. I mean, firstly, that's completely amazing, sort of how in-depth you go. And I know you use all sorts of amazing imaging devices as well to go that much deeper, don't you, below the surface of the skin, into the scalp, into the body. I mean, the machines that Sherina has in her clinic are quite something. I mean, you basically turn into a 3D avatar, it seems, when you have these photographs taken and you really can assess everything about your mobility and your posture and your hair and your skin. It's really amazing. But when it comes to the skin, because a lot of what we see in the skin is hormonally driven again, you know, we see pigmentation come about with pregnancy, we see acne sort of related to polycystic ovaries, we see rosacea is very commonly linked to sort of later sort of menopause. So I'm interested to know how you start with a patient. How do you get their skin back to that even keel when the hormones are really, really wreaking havoc in it?
Well, it's important for patients to connect with what they're going through as well. So following the history, we take a full diagnostic. Jenya talked about having a baseline investigation. So at the clinic, we have an imaging suite called Visia. So this is where a patient will put their face, chin in a cup, and then you have a 360 image of what your skin is looking like on the outside. Because there's no point using a mirror anymore. You want the patient to be face to face with their own skin.
And this is the one that gives you a chronological age as well as the age that you see obviously when you do all of these photographs, which is quite terrifying.
All very good.
All very good. I don't know, do you have many people who are very good?
Like a few years. So it looks like 8 key areas of aging concern. Lines and wrinkles, textural change, because also we accumulate dead skin. We also look at pores because, as you know, with more androgens and lesser estrogen, we get more oily in the T-zone, which is the area the good Lord made us anyway. And then we also look at redness, facial redness, and this is something that I see as a pathology. It's becoming a real problem because of the excesses of life around us. If you look at a pie chart, 35% of how we age is due to genetics. So hopefully the good genes have been passed on from our parents to us, but that's only 35%. It's out of our control. The other 65% of how we age is actually in our control. It's due to us.
Epigenetics.
Absolutely. So this is what I call epigenetics. Epigenetics are lifestyle, behavioral habits, sun, sugar, sleep, stress, hormonal balance, as well as the bad stress, and so much more. But stress has become the main indicator. So when patients relate to the picture in front of them, we can also score their biological age, which is how they actually are aging, with their chronological age, which is the number of candles on birthday cake. And if we can see a disconnect between them, then the patient will realize, actually, I am not where I should be and where I need to be. Because when patients can see the disruption in the skin barrier, that's when I examine patients from the back. I literally will go behind you and I will feel everything from your forehead, your soft tissues, your eyes. Don't forget, your eyes also age very quickly when your hormones are off balance and you're accelerating, because the skin around the eyes is 10 times thinner than the skin on your face. And that's why we need different topicals here that are very precise for the periorbital area. And it has to be different for the skin on the face. But then I'm feeling for the roughness of a disrupted skin barrier. And I'm seeing that every single day. Maybe due to pollution in London as well, or Shanghai, or where patients may come from. But that is a really common problem, a disrupted skin barrier. And when that skin barrier is not robust, and it's not resilient, and it's not functioning normally, then we have something called transepidermal water loss. We're just losing water, irrespective of how much we're drinking. People don't drink as much anymore as well. 1 to 2 to 3 glasses of water. A lot of patients are saying we need to be on 2.5, 3 liters water to make our cell-to-cell communication, that cell signaling pathways, all of that to be performing at high function. Because we are just one big living cell. Livers, kidneys, lungs, hair, all of it. So 2.5 liters really is key.
So is there an element of going back to basics when you spoke about different topicals for different parts of the body, you spoke a lot about increasing water consumption. Is a lot of what we need to do actually just stripping back the skincare and taking those sort of very, very sort of curious terms every single day when we're sort of putting things onto our faces?
Very, very much so, Francesca. You know, we're in a generation now where I can order something on Amazon and it's there by the evening. I can order retinols and it's there, you know, very, very quickly. And I sometimes wonder, gosh, these young girls, they're seeing and they're Instagramming and they're scrolling, and we didn't have that when I was growing up. So we just either went to the doctor, and now we're being a little bit more careful. But there is an over-processing of the skin as well, which just comes with the sign of the times. And sometimes we need to actually see the skin up in front of us and take the hormones and take the geography and take the environment and actually realize we're doing too much, and we have to scale it back and go back to basics. And the disrupted skin barrier will actually disrupt the microbiome. So we have a gut flora, we have a natural skin flora as well. And when the skin flora is just unhappy, it's disrupted, then guess what? Those bacteria can then see through the pores and get through to the oil glands, and that's what's causing the problem. So that may not necessarily be a bacterial acne, which is what people are doing for antibiotics and doxycyclines and things like that. That actually could be just chronic inflammation of the skin because of disrupted skin barrier. So we have to go back to basics and heal the skin barrier using topicals, emollients. We do high-tech oxygen facials, we do the light drainage, we do so much light therapy just to get the skin from its -20 back to its baseline, and then we can go forwards with your slightly more aggressive topicals to start resurfacing the skin. And then we can also bring in the energy devices. Only then can I put in my facial fillers, because if we put in facial fillers with a disrupted skin barrier and an unhappy microbiome, guess what we're going to do, as well as the redness and rosacea? We could actually give the patient an excessive risk of developing nodules and granulomas at the end of the day. So skin health in a plastic surgeon, in all of us, is critical that we actually get that right. And then we move down to the neck, and then we move down to the chest, and then we move down to the body. And the body really changes as we go through hormonal health and as we go through aging. And that is all just pure anatomy and hormones.
I'm pleased that you mentioned the energy-based devices as a sort of follow-on from the topical skincare, and I'd love to explore those a little bit more, because hormonal imbalance can really address a lot of the building blocks of the body. We see a really dramatic decline, don't we? You mentioned osteoporosis, so bone loss, muscle mass really sort of drops, and I'm sure Gino will sort of talk about that a little bit more as well. The collagen, that the skin quality, everything does seem to, I hate the analogy falling off a cliff, but everyone uses it time and time again. So, I mean, you see sort of patients from all ages and stages of life, but how are you integrating these amazing energy-based devices to really rebuild the body? Because that's what regenerative medicine is trying to do right now, isn't it?
Absolutely, Francesca. So if we look at the building blocks of our body, so let's just take the skin. We've got proteins and sugars, and then we have the water. So your proteins are collagen and elastin, so they're the building blocks of the skin. Collagen thickens the skin, elastin gives us our stretchiness. So over the last 20 years, we have been using topical skincare, we've been using energy-based devices like radio frequency, we've been using microneedling, ultrasound, we've been using so many devices to trigger that collagen cascade, because we lose 1% of collagen. We used to think we lost 1% of collagen every year after 25 or 30, but we actually start losing it a little bit earlier now just because of how life has taken over in the modern day.
That's interesting. So actually the way that we're living is accelerating the way that we're aging.
So we've been triggering collagen really well with energy-based devices as well as with light therapy. Elastin we've not been able to stimulate to such high levels up until the last 12 months with the launch of new devices like the BTL Exion, which incorporates now fusion of two technologies, radio frequency together with ultrasound. So our device manufacturers in my world are getting very, very clever. They're getting very precise. They're really getting the histology and getting elastin production. So we're seeing changes in the neck in our patients that we're treating, even in their 78-year-old patients, the way that we bring them up to success. And we're seeing elastin production with these devices up to 224%, which is huge. And then we're also seeing changes in the sugars of the skin. So the sugar of your skin now is that hyaluronic acid. Hyaluronic acid is not water, it's a sponge. So the more hyaluronic acid we have, the more plump your skin looks, less lines, less wrinkles, more full, more luminosity, more glow, because it's abundant. And then when you tank up to 2.5, 3 liters of water a day, better cell function. So guess what? You're gonna look better, you're gonna get less acne, less spots, and it's gonna start shrink wrapping because it's all working in harmony with collagen and elastin. But we also lose 1% of hyaluronic acid, not from 25. We actually start losing it from birth. So guess what? We need to start thinking about adopting HA, incorporating treatments and topicals and procedures from much younger. But we've not had anything beside topical skincare, injectables, supplements of hyaluronic acid, and we've done well with that. But in going back to your point, Jenya, when we're artificially supplementing our tissues, you mentioned a certain type of hormonal replacement, not bioidentical, then we could be suppressing the body's own innate way of producing it. So we're kind of like stuck between a rock and a hard place. So now we actually have brand new scientifically made topical skincare skin systems called exosomes and secretory factors that come from plant-derived stem cells. So I've always believed in plant-derived botanicals. I've had one for 9 years, but now we have a plant-derived stem cell that releases these secretory factors, and they upregulate the body's own hyaluronic acid.
I think that's such an exciting sort of movement forwards in your world, certainly as well, actually encouraging the body to repair itself, regenerate. You mentioned the plant-based exosomes. How are you applying those to the skin? Sort of what are you doing in clinic?
Well, we're doing it in so many ways. Standalone patient comes to us, we need to drop down the inflammatory response. So I have this word called inflammaging. So inflammation and aging. So we call that inflammaging. We are all inflammaging to a certain degree, some of us more than others. And what this secretory factor of skin system does is it dampens down the acute inflammation by up to 61%. So when I have a patient who's inflamed in the skin, and she's keen and she needs to have an energy-based device to stimulate the collagen and elastin and lift the skin, or to work on stretch marks and acne scars and things like that, we want to get the skin healing fast. It's got liposomes in it, so guess what? The barrier of the skin is being repaired much more quickly. And then finally, it's also taking the body through is making of collagen and elastin and hyaluronic acid. So our patients are repairing faster, they're healing faster. They're also regenerating a lot better. We're using it on the scalp, we're using it on stretch marks on the body. We're also using it potentially in the future as a drink. So I think watch this space because new generation topicals have come such a long way in this last year.
100%. And you mentioned earlier a lot of the hormonal change that we see, that your patients see, is within the body as well. What are the ways that we can actually address the key signs of the body that change? What are the things that really bother people when they see sort of hormonal imbalance affecting the body?
They see a shift, Francesca. So, the general thing is, I feel everything just kind of like dropping down. And we have to realize that the fat in the upper body, above the belly button, the umbilicus, it's a different type of fat, it's different composition from the fat below the umbilicus. In girls, less likely the boys. And because of that, women shift and everything suddenly starts accumulating and they start pinching, more so if they've had a cesarean section. So that's something that we need to identify because very similar to collagen, elastin, hyaluronic acid, we also lose 1% of skeletal muscle every single year beyond a certain age. But the other thing that accelerates skeletal muscle loss, main thing is sedentariness. So post-COVID, sedentariness has been a huge problem because we're not walking around, we're not catching the train, we're not hop-stopping at desks to chat to our friends. We're spending 8 hours a day, sometimes more, and with our corporate patients who are Zooming and webinaring with their American colleagues, they're doing it all night. So sedentariness, as we know, causes a massive decline in skeletal muscle loss. And if you think what happens to an older patient in their 70s and 80s, they struggle to get off a chair. So all of you try lifting yourselves off a chair right now. The first muscle that you contract is your glute muscle. It's the first muscle that you actually do. And then you've got your heels on your ground and you're contracting your calves and then your hamstrings and then you get your core. So whenever you think of somebody coming in and I ask them what they do, how many hours do you spend on the computer, how has your life changed? We've got to think, okay, if your life has shifted in the last 4 years, there has been an acceleration to your muscles. I bring in treatments like my personal trainer, which is really, really key because we need to start getting the patient realizing that they've accelerated in their skeletal muscle volume loss in the last 4 years. So we have new generation devices that stimulate muscles using high intensity focused electromagnetic stimulation, called them Scalp Neo. And these are device companies that have brought this to fruition for almost 30 years. So these are nothing new.
They're all rooted in rehabilitation, aren't they? Sort of developed by physiotherapists. It's fascinating. I can see Gino nodding.
He's not
Tried this.
Real nice. So I actually talked to a patient and said, beyond the six-pack, we all want a fabulous body. We can get the fat loss with that because it also synchronizes radio frequency. We've been working with radio frequency forever. So we can stimulate fat loss as well as muscle gain now. So I don't just look at fat loss anymore. We all want that. So that's almost like a tip. We have to deliver that as doctors. But it's the muscle gain that's really important because all our patients with back pain, they've got weak cores. They just do. And especially if you have a split muscle after pregnancy, which is called diastasis recti, you got to treat that. And if we can treat that beyond surgery using a non-invasive device that gives you 19% improvement in diastasis recti in 30 days, if we can get you 25% increase in muscle bulk in 90 days, then guess what? That's huge. Because that is 4 years of decline, and we can get that back in 90 days. So anyone that treats their core, I also advise them to all have their glutes treated. Because if their buttocks have been wasting away because we're sitting on chairs a lot more, guess how we're going to accelerate in our aging? We're not going to make it till 70. We're going to be doing this in our 50s and 60s. And we're going to have a problem getting up. And my next view, I'm going to be treating the calves as well, because I think that's a really critical area. And to improve the lymphatic drainage of the whole area, because we're being sedentary, I will be treating the full leg as well. So I see a huge amount of rehabilitation from sedentariness, from hormones, and these types of devices like Scott Neo. And then finally, we've got devices now in the last 1+ years to stimulate the muscles of the face.
That was always the missing link, wasn't it? Whenever we saw all of these muscle stimulation devices for the body, we were going, one day they'll come for the face and it's going to be amazing when it happens. And you're obviously making waves using the face in your clinic as well.
Not to mention the pelvic floor. So we've been talking about stress urinary incontinence, we've been talking about cervical changes, and if you just wrap around that whole area, the rest of the skeletal muscle is in the pelvic floor basin. I don't have children yet. And we're all at that age, but I still also have symptoms of change. So we have to address that whole pelvic floor basin is going to get weaker. We can do Kegel exercises, we can clench till whatever. But at the end of the day, that is a huge chunk of pelvic floor skeletal muscle that is also changing. So we have a high intensity focused electromagnetic stimulation device like the Scott Neo, but now for the pelvic floor called Emsella. And we can deliver 11,000 super maximal contractions, which is more than a human can ever achieve in just 28 minutes. And same again with the abdomen, 20,000 of these 100% contractions in just a 20-minute treatment, which is really, really fast. And then if you throw an LED, everything accelerates even more.
I was just about to say, I think it's amazing because not only do these machines have a physical output, you genuinely feel, you stand taller, you feel stronger, but I think internally you feel better as well, you feel more confident. I mean, something like the Emsella, to get control back over your pelvic floor when it's definitely sort of misbehaving is a really empowering thing. I wanted to finish off by talking about cortisol, because you mentioned this right at the beginning as one of the stress hormones that is evidently playing a huge role in how we're aging and how we're dealing with the effects of age. How in your sort of modern day patients are you really helping them to manage cortisol? What are the devices you're throwing in? What are the techniques and the treatments that you really feel are proving beneficial now?
There's nothing that beats the human touch. Really nothing that beats the human touch. So there is a lot that we can do in clinic, from topicals and technologies, energy-based devices, but I always go back to the human touch. So I think patients need to realize that they're working on a certain level of stress. A lot of my patients actually have what I call good stress. It's just called high-performance living. Everybody wants to do a good job at the end of the day. We want to deliver, we want a deadline.
Stress does drive you, doesn't it? From
I like to really stress, I thrive on it. But at the end of the day, that's what I call good stress. But when it's prolonged, how long, and I get my patients to score themselves. Give me a score from 1 to 10. No, it's no stress, 10 out of 10 is, I'm like that every day. So most of my patients are 9, and some of them are 11, and very few of them are 4. So we got to realize that your tension in your muscles are tight, your intercostals are tight, your spine is tight, your strap muscles are tight, you're not detoxifying your face, you're getting puffy, you're getting breakouts, the skeletal muscle is also aging, so we gotta work really fast. So I get everybody in for a consult, assessment, digital imaging. The first thing I do is actually put them through lymphatic drainage with one of my team on their face, as well as their body with lymphostim, which is full lymphatic drainage trousers, to start shifting that toxins away very, very quickly, and they're all plugged in. Then we do an oxygen facial in their face using hyperbaric oxygen, which is a healer. So we start that detoxification process, and we cover their face and their scalp and their whole body with Soluma LED. Because aging is also a loss of perfusion. Aging is also a loss of vascularity, and aging is also a loss of energy. So we don't produce as much mitochondrial activity as we did when we were older. So think of the electric car, we just charge you up. Because we know these are scientifically beneficial devices, they're proven that upregulate mitochondrial activity. So the patient develops a better function. So besides that, we also then think about what else can we do to upregulate, downregulate cortisol. And that is the power of massage. So I incorporate massage, whether it's for the face and whether it's for the body, in all of my high-tech energy-based facial treatments. I also want to touch on facial injectables, because when we feel our patients, again, they're tight in the jawline, they're tight in the neck, and we know using electromyography studies that there are certain muscles that also get hypertrophic and also active, which is the procerus muscle, which is that one. So there is a reason why we should all have a little bit of Botox from time to time, because the anatomy and EMG tells us so, as well as frowning at the kids. So I use toxin very strategically on the frown, as well as the eyes to lift the brow. It automatically makes people feel better. And I also do a lot of toxin on the jaw, at the masseter muscle, because everyone's clenching and grinding and they're going to burn down our teeth too quickly. And I use a lot of toxin on the neckline, because with too much tension, there's a lot of neck discomfort as well. But ultimately, aesthetically, we also get platysmal bands that pull the jawline down. So there is this synergistic blend between hormonal changes, aesthetic changes, anatomical changes, EMG changes, CT, MRI. It all just kind of comes together.
It definitely does, and just listening to you, I love how high-tech yet holistic your entire practice and your ethos is. It feels like there's a little bit of everything for everyone, and I feel like that's the best way to be. It's the best thing to find in a doctor. Thank you so much, Sherina.
Thank you.
Our last speaker is Gino Raccuglia, Head of Fitness here at the Peak. Gino, you see a sort of wide variety of women training here who train with you. What are the sort of hormonal health issues that, or concerns that they might have? Do women talk to you about this?
Sometimes. It depends on how close my relationship is with them. Most of the time it's about their cycle and how they feel. They might sometimes cancel their sessions with me, and sometimes they just feel so demotivated and their mood is so low and they just kind of pause the session. But it's important to try and recognise everyone's different. It's important to recognise that you don't always have to go 100% of your training according to your goals. You can maybe visit a cardiovascular method. You can go into a bit more relaxation, focus on breathing work. So I do have a few clients, for example, who are pre and postnatal as well. Obviously, going through pregnancy, before pregnancy, hormones are all over the place, all changing. So we have me and one of my other trainers who's qualified pre and postnatal. So there's various types of exercise we try and avoid. There's exercise we try and influence more to prepare you for motherhood, to prepare for the recovery of after birth. And just basically, it really depends on how open the client is with each instance.
I think a lot of it is understanding what type of exercise to do at the right time, and you sort of mentioned sort of being more aware of your cycle. What are the types of exercise you do steer women towards when they're trying to better support their hormones?
Well, a lot of resistance training, first off. So activating a little bit of muscle growth, as we said before, as you get older, muscle deteriorates. So we want to try and keep hold of that. There is a stigma of training too much, you start to get bulkier, but it's actually what we want to try and do is try and stimulate the muscle continuously, so it has that kind of method of staying where it is and kind of almost balancing out the negative.
And I suppose building a better framework as well for the body. It's our scaffolding, and so sort of strengthening in the appropriate way is what's going to keep us upright and fit and healthy.
Exactly. So there's a training method that I use with my clients is you always want to try and train the body as balanced as possible. So there's a saying, outside, out of mind. A lot of people, predominantly men, but they tend to train what they see in front of them. So they train the chest, their shoulders, their triceps. They don't realise that their back is such a big muscle, it's so important to your posture and the way you function that sometimes they don't train it enough. And that goes with everyone, really. So I tend to adopt a lot of my clients very specific sort of postural exercises that there's those little muscles that kind of make all the difference when helping you hold your posture. Sometimes you get into the point where it's so strong where you don't even realise you're trying to hold your posture up. So those sorts of exercises are trying.
So what are the muscles that we're sort of really looking to activate, and what are the sort of key exercises we could be doing in the gym in our classes to really strengthen and support those?
So the rear delts, the trapezius, the lower trapezius. Also, exercise that I love, which kind of incorporates all that, is called a face ball. It's basically drawing your hands up here and try and get all the muscles incorporated in your upper back.
You're doing that with both arms at the same time?
Yeah.
With weights.
Yeah. No, with a cable or any sort of resistance, you can kind of manipulate it according to what you're using.
And what about when it comes to the midsection? Sherina spoke a lot about the sort of connection between the abdominals, the pelvic floor. Is that an area that you find beneficial to sort of work on with women? You know, we sort of spoke about sort of the pelvic floor sort of giving way slowly over time as well. What can we do in a gym capacity to really strengthen that part of the body?
Well, that can be done in a gym and also at home. So things like the traditional plank, for example, but stuff where you put yourself in an unstable environment as well. Obviously try and get a little bit of guidance with it, but when you're pressing something above your head, you're using your core muscles, making sure you're keeping your posture right. There's various amounts. Also, like you mentioned before, glutes and your hips are very, very important. They all play a part. I never really train just the core area without training the glutes, without training the upper back.
It's keeping everything in balance, isn't
Exactly,
it?
yeah.
Because everything is linked to everything within the body. It's the most fascinating machine. What about when it comes to the sort of nutritional side of what you do? That's obviously a huge part of the conversation, I'm sure. How do you help your clients navigate that? Because there are so many diets, there's so many fads going on. Is that something that's very easy to be sort of waylaid by as a client, or how do you help us manage it?
Well, it all really depends on the goal and of the client, but especially when doing any resistance training, the best thing to kind of incorporate is having a good, healthy balance of protein, good fats, and complex carbohydrates. Protein is usually missed a lot. It's basically the building block of everything. Carbohydrates and fats can all be turned into energy, and protein can be turned into energy, but the carbohydrates and fats can't be turned into protein. So that's the only element that cannot be anything else. So the most important thing with protein is making sure you get adequate. It's good for skin, teeth, hair, and of course your recovery.
And muscle, yeah, exactly, and recovery. Is there a way that we can figure out how much protein we need to be consuming? Because I think for a lot of us, we're evidently not consuming enough of it.
Well, I would say if you take your weight in kilograms and you times it by 1.5 to 2, that should be a good balance. I mean, 2 grams per kilo might be overdoing it, but some foods you won't always get, that actual amount of protein.
And the body actually has to work all the harder, doesn't it, to break down protein, so you almost burn more calories when
Yes.
you are consuming a good amount of it.
Exactly, yes. Obviously, because the body takes a lot more time to digest the protein, you'll feel more satiated. It's easier to stick to a diet that you've basically planned out.
And how do you help those? Because I think we often talk about the sort of hormonal belt, that area of the body which seems really to attract sort of weight as sort of hormonal imbalance starts to become an issue in later life. So is there a way that you can help women to really sort of streamline that midsection of the body through their nutrition? Is it down to what we're eating? Is it down to how we're eating, the sort of tools, techniques?
Well, we want to stay away from a high intake of sugar, not necessarily at all. It's just continuous high intake of sugar, because that's going to increase your insulin levels, and you're going to end up storing more body fat. But the best thing to do is working out a calorie balance. So you work out your calories. You take, especially if you're trying to lose weight, you take a reasonable deficit. So let's say 200 to 250 calories of your maintenance calories, and you try and subtract that with from carbohydrates and fats, leaving just your protein.
So you end up on a very high protein diet essentially. And what are your thoughts on things like intermittent fasting? Because that can be really powerful when hormones are sort of slightly out of whack. Do you find that has benefits on the women that you train?
Yes, I mean, there's all these diets, basically the best diet is the one that you can stick to. So intermittent fasting is an amazing tool because it gives you a limited amount of time to eat your calories. So you've got a set rule of you eat from, let's say, 12 o'clock to 8 p.m. and then you don't eat until the next day at 12. So that's an amazing tool. Also in the morning, you're not digesting anything. You know, you're a bit more clear-minded. You know, your body's working on repairing itself until your next meal.
Yeah, it's so true. When you're intermittent fasting, I feel that the headspace and the mental clarity you get is absolutely incredible. What are your thoughts on the things that we should be steering clear of and really avoiding when it comes to trying to better support our hormones? Maybe fitness fads, maybe types of training, types of food. You mentioned obviously sugar. I'm sure that alcohol is obviously included in that to some degree.
Yes, alcohol especially. When you consume a lot of alcohol, your body wants to burn off the alcohol first before it attacks any of the calories you ingest. So if your goal is to lose weight, and let's say you have a heavy night and you eat some food, you're not going to burn any of the calories that you have ingested from the food until you've burned the alcohol off. So ultimately, that's why it's called empty calories, because you're not really gaining anything from it.
It always floors me how many calories are in a glass of wine when it goes down so easily.
Yeah.
And tell us, what about the other sort of fitness things? Do you see sort of an over-reliance on things like HIIT classes or the cardio, getting on the treadmill? I feel like so many of us are just sort of, we walk into a gym and the first thing we do is jump on the treadmill, and it's not always the best thing for us, particularly when sort of hormones are maybe all over the place.
Yeah, I mean, probably the best thing is you can still do like a HIIT sort of setup. The only thing I'll stay clear of is like a traditional HIIT class where you see burpees, jumping around, especially depending on what time of the month you're on, it can be a bit damaging to your joints. So you want to stay clear of sort of high impact movements. More stationary cardiovascular, so working your cardiovascular system higher on a much smoother machinery like a cross trainer, bike, that would be a bit more beneficial to you. And obviously a bit more of yoga, Pilates based.
I was going to ask you about the power of reformer Pilates, particularly because you were talking about the importance of resistance-based workouts, building muscle mass. Do you offer reformer Pilates here? Is that a sort of big part of your repertoire?
We've trialed a reformer here, and it's just been taken back, but we have ordered one.
Oh, good.
And yeah. But it's an amazing tool to have. It obviously works the body through stretch rates. And also it increases your mobility, which increases also your posture.
Yeah, 100%. I think it's.
It was just a trial.
The pool was.
Yeah, it was trial.
It was a trial upstairs. It was just a trial, so we didn't own it, and we're just seeing. But members like it.
Them in the pool.
Yeah.
But people are obsessed with reformer. It's definitely sort of.
We're trying to bring it back because we know how much.
Yeah, exactly. And final question about recovery, because I think as much as we can sort of be eating the right things, we can be working out in the right ways, it's really important that we recover and sort of really give our bodies opportunity to rest sufficiently as well. What are your tips for sort of allowing that to happen so that the body can repair and regenerate after it's been working hard in the gym?
Sleep is probably the best recovery tool, as well as adequate nutrition. Best advice for sleep is try and stay away from screens, TVs, things like that. Also, magnesium is a very good supplement to take to help with sleeping. I would say that's probably my best one.
Magnesium, definitely. I know when I was pregnant and my legs were sort of so heavy, I was using this magnesium spray all over them and all over my body. It was amazing, sort of, as an alternative to the supplementation. Thank you, Gino. That was really, really interesting, and I'm sure if there are any more questions for Gino, we'll be around for a little bit longer as well. I think that very much takes us to the end of tonight's conversation, at least the panelists sort of part of it. And I just find it fascinating sort of listening to all of you, because each of you deals in such a unique part of the body, sort of physically and emotionally, but actually you've all got such practical takeaways and solutions to leave us with. And I think sometimes when our hormones can feel like they're out of whack and out of balance and we're slightly out of control when it comes to them, it's really empowering to know the simple, quick fixes that we can do at home, as much as it is knowing that there are solutions when we get in front of you amazing people and into your clinics and into your amazing spaces. So yes, a very big thank you. If there are any questions, please do stick around. Yeah, Marie has one already. I was just going to say, if you do need to leave them, please don't forget your goodie bags, referral cards you can leave on the chairs, and yes, we'll be here for a little bit longer. What was your question, Marie?
Can I take that?
Yeah.
Hi. Yeah. I've known Francesca for ages through Tatler. I'm here at the club, so I know the classes, and actually I did a Qigong class that was absolutely fabulous, where they asked you to visualize your liver in yellow, and you had to touch your liver, which I didn't even know where it was in my body actually. But it was very, very useful, and I wanted to thank Jenya and Sherina for this amazing talk. And I can see that your body, your mind, your spirit has to be aligned. You were talking about the human touch, the massage. You were talking about herbs that my grandmother talked to me about, and I was like, God, I am not eating vegetables, I just don't care. but now, with my age, I just go back to it because of the hormonal change, and I think it's fabulous to hear you. So I'll make sure to visit Cloud 12 that Francesca mentioned, and your I can't even pronounce your clinic's name because
Aesthetics.
But thank you very much. I just wanted to thank you. I have a question.
Oh, that was I was waiting for the question, but actually thank you very much, and I totally agree. I feel like everyone here is such an authority in their sort of given area, and it's amazing to listen to these conversations unfold. And yes, I have many questions for you, which I will ask afterwards. Were there any other questions from the audience? Hello.
Oh, thank you. No, thank you. So I have a question for everybody. First of all, thank you. But each respectful, where would you expect a patient to begin, or from? Am I making any sense?
Where would you expect them to begin?
Yeah, where would a patient begin from everybody's perspective?
At what stage?
From the very beginning, where does a patient start?
Jenya, do you want to start?
Sure. With me, it would be food first approach. So I spoke a lot about herbs, but actually, the building block of hormones, reproductive hormones, is actually cholesterol. So it's your good fats. Without that, we're going to be deficient. So I can give you all the herbs I want, but you need to eat well. And also when we speak about the proteins, we need to not just eat good proteins, we need to digest them. And so, sometimes if you're thinking about a supplement, if we're talking about protein supplements, they would be in the form of peptides or amino acids. That's why collagen works so well, because it's already in a pre-digested form. And then, of course, we look at not just what we eat, but what we eats. So, all the meat and the fish, they're so toxic these days that they're not organic. So we need to just cover the basics of eating clean, simple, nutritious food, which is the building block of not just hormones, but every cell in your body. That's where I start. I do end up with functional tests, because sometimes, you're doing your detective work, you start from the basics, and then if the person has been ill for many, many years, you might not even solve it in 3 months' time. You need to start with the basics and then leave no stone unturned. So it might get quite complex by the end of our journey.
But food is a nice, simple place to start.
It
Sherina?
is.
You're going to have to pass this one.
Thank you. That's a great question. So for me, it would be to start with a great consultation. Our mission is to listen. So from consultation, we then have our diagnostics with the imaging. We'll do a facial scan, we'll do a 360 facial scan using a Vectra 3D, just look at the contours, face and neck, as well as the body. And then we also use a digital hair metric system, which also looks at your inflammation of your scalp, follicle count, follicle density, interfollicular distance. So it just gets everybody thinking about the whole 360. In the consultation, I bring up specific lifestyle because I think behavioral modifications is really critical in order to achieve the best result. So sun, sleep, sugar, out, stress, as long as we're mindful, as well as alcohol consumption, and then diet and nutrition, because it's really important that the patient also takes accountability for what's going on in their lives so that we have variables that are managed. And then we bring on to the treatment planning. From topical skincare, it's interesting, you talked about Centella asiatica, that runs through a lot of my first line of skincare because it's a healer. And now obviously we have these new other things to do stem cell variables. And then from technologies to high-tech facials to injectables. Injectables are certainly integrated into all of my energy-based devices. So I capture that in the consultation. You don't have to have it done everything at once. And then finally, with the treatment planning, we schedule appointments according to what the patient needs and wants, because you have that email to you at home. And then we follow through. The follow through is more important than the treatment itself, because we want to quantify and measure the success of the results. So for skin and face, I bring everybody back at 6 weeks to assess changes, 4.5 months, which is 3 skin cycles, and so forth. So I love the consult, the imaging, the diagnostic, the treatment planning, and the follow through.
Yeah, we can pass this one back. Thank you.
So for us, it starts off again with a consultation. We find out more about the client's lifestyle, their goals, any injuries they might have. Then we go to something called a movement screening, where we go through certain tests depending on the movement of the body. Things like maybe even just raising your leg, how far can you put your arms above your head, places where it might cause discomfort, so we can kind of treat the areas. Going on from that, we design a program tailored for the client's needs, so the findings that we get from our movement screening, incorporated with their goals as well. So we try and give them what they want and also what they need.
It's nice because it seems like all of you start at a place which almost becomes a bit of a touchstone throughout the whole journey as well. It's not just one thing that is sort of started with and then dropped and forgotten. It really does create that blueprint moving forwards, which is a good question. Thank you for that. Is there another question? Yes, Celia. Would you like a mic? Just give it back afterwards.
Thanks. Thank you all for such an amazing session. A million notes here. So obviously a lot of what we've talked about has been to do with stress, and I'm kind of at an age where I'm hearing more and more that I do a lot of endurance sports, I do a lot of cardio. I do strength training, Pilates and bar and stuff, but generally I'm hearing a lot about stress in the body and how I shouldn't do loads of running and cycling and how that's going to increase my cortisol. Also things like
And impact on the joints.
well, usually and intermittent fasting and how that's going to stress my body out because it's just going to increase cortisol. So I'm just wondering whether you have any views there on the impact of, well, I guess, cortisol on the body in terms of endurance and cardio, and also intermittent fasting, and whether that is a load of nonsense or whether there is some truth in that.
Thank you.
With intermittent fasting, there is like this big discussion about all the other effects beyond weight loss, the health benefits that you get from it. I think that's very personal. Some people might feel it, some people don't. The stress that you might think may be caused by cardiovascular, it might be just you're not giving yourself enough recovery. But there is so much information out there, and a lot of it contradicts itself sometimes. So I think we need to really find what works for you. The best thing I would say is try and dial everything back and see which one benefits you the most. So if you feel like, if you've heard like a lot of cardiovascular is causing, like for example, a lot of HIIT training, or if you're going out for runs and that's causing you stress, maybe dial that back and then kind of do like a process of elimination and see what happens. How that feels.
So a little bit of trial and error. Sherina, do you have any thoughts?
It's a really great point, and I'm reflecting on my clinical practice. If our patients are very stressed, the chronic stress, chronically inflamed, the disrupted skin barrier, I bring it back down to maybe the skin and the body. I would use the same analogy and strip it back and actually just take it back a little bit. And I think the recovery of the muscles, the soft tissue, the recovery of the skin is really important to bring that person back from -20 or -30. I get the patient to actually tell me, how are you actually feeling now? Because not you, but one might look really tired just because they've been flying all over the world for work. They might be looking after children at home and coming back after 5 days or 2 weeks away, and everyone's just exhausted, or maybe just overwhelmed, and maybe also stressed, and maybe also going through that 40 to 55 transition. So I think in life we're all just kind of transitioning, and then throw in a couple of ovaries, oh my gosh, you know. So with the transition of life, I get the person to tell me, if you had to put your baseline at 0, and that's just you on a good day, where are you now? And if someone says, I'm probably on a scale of 0 to 100, I'm probably on about a 70%. So that means you're actually -30. So I have to spend some time addressing the skin, the health, the hydration, eliminating all of the negatives. Make sure you're sleeping well, make sure we get the right topicals in you, the right LEDs, and then we can do the trigger treatments. So for example, something like microneedling radio frequency, I'm not relating to you, but these are treatments that can be very inflammatory, but not in a negative way. We're creating inflammation to grow new tissue, to grow new collagen, to grow new elastin, to treat scars, so that the new skin can actually look and function better, right? So we're triggering the inflammatory response to get a good deal. But if someone is stressed and they're inflamed and they're tired and they're negative, they're going through a crashing cortisol dump, then we shouldn't be triggering them. Then we need to prepare them and bring them up to a certain point and then trigger them. So I guess the same probably goes across all 3 specialties. Does that make sense?
I think you're right though, actually, and you mentioned this earlier, Sherina. It's about sort of identifying the good stress versus the bad stress.
Sorry.
It's totally fine. There's no exit. And sometimes, you know, the stress on the body, like intermittent fasting, it might send cortisol soaring, but, you know, from what I've read, it also stimulates all the dead cells to be swept, right? And it regenerates the body and it clears the mind. So I guess it's weighing up what is potentially a negative effect versus what could still be very positive, but it has to be right for you. Sorry, you go now, Jenya.
Yeah, well, that was exactly my answer. So whether it's good or not would depend on how you feel. So, in consultation, for example, I would ask about the levels of your energy, whether you're fatigued, what's your lifestyle like, are you susceptible to all sorts of infections? So essentially whether you have strong vitality or low vitality. What we could also do, we could do saliva testing, which would track your cortisol and melatonin throughout the day. And so we will see if it's in line with how your circadian rhythm should be, where your cortisol spikes in the morning and then it kind of gradually trends down during the evening. If that is reversed, which I often find in people who are tired and wired, so come evening, they're very tired but yet they can't sleep, so the cortisol is actually really, really high, which won't allow them to sleep in a restful way. For those people, I would say absolutely no high-intensity training, especially in the evening. And also, when the cycle is so disrupted, that would indicate to me that the adrenals that produce cortisol and our energy hormones are fatigued. So you need a very gentle approach to kind of reset that rhythm. And in that sense, anything drastic for the body, like fasting, for example, intermittent fasting can be fine, but anything drastic would not be recommended. You need to go into kind of hibernation mode to rebuild yourself back to strength. And also, sometimes I do not advise intermittent fasting for women going through kind of perimenopause, menopause, where their insulin starts to fluctuate. Because
This is what I've heard.
Yeah, so it depends on the person, right? So if your insulin fluctuates and you're fasting and it drops very, very low, you might end up feeling very, very fatigued and have some other uncomfortable symptoms. So if it kind of is all over the place, again, we want to stabilize it, so we kind of want to feed you throughout the day gradually. I'm actually not a fan of snacking, so that's not what I mean. It's actually not very good for your gut health, but in a sense, I need to know your symptoms. I need to know who you are as a person, what are your genetics, or what's your family history, kind of all of that before I answer that question. But if you're in balance exercise away and do intermittent fasting because it's wonderful for a healthy person.
That's really interesting because actually it goes full circle back to the power of the consultation, which all of you spoke about, and you're so right. I mean, actually tracking these signs, the language of your body, getting to know it a little better, I guess then you can know what works for you and what doesn't. But there's so much out there, there's so much information, and it's always changing and it's always evolving. So great question. Were there any other questions? This side of the room? No? Well, oh yes.
Would you like the microphone?
Social cellulite, besides exercising, fasting, healthy food.
Cellulite, did you say?
Put it to genetics, of course, and other aspects. Any quick solutions or any lots of solutions?
Can I suggest some exercise actually, very quickly, which is trampoline, which I absolutely love. Not just because 10 minutes on a trampoline are equivalent to 30 minutes run, but it moves your lymph and lymph congestion as at the core of the cellulite. It's also as a good prevention for osteoporosis, burns weight. So I advise that to a lot of my patients, but it is about moving the lymph and making your cells work efficiently. And there would be some herbs. So one of the herbs that I would use for people who have problems with cellulite is cleavers. So this is the herb which cleanses your lymph. Of course, you know, to move the lymph, you do need to exercise or move, or have a massage and have someone move it for you. That also works. Chen I love. So that there would be some herbs that help fat cells to metabolize effectively. So Chen which is orange peel, is another herb which is great. Cayenne, which is chili, great for circulation. You know, kind of stuff to renew, so dry skin brushing, those kind of things. It's not just for your lymph, but also kind of getting rid of dead cells to facilitate cell renewal in that way.
Thank you, Jenya. I love the idea of the trampolining. I've just started a reformer Pilates class where they have a little springboard on the end of the reformer, which seems like the perfect solution.
I'm so
Building
obsessed.
muscles plus the cellulite properties.
Yes, I just recently posted an ex. I was so obsessed, and I'm not a PT or an expert in training, but the benefits are just so incredible. And what I want to say, you have to buy the right trampoline. I kind of resisted it for a long time. I thought it's going to be so hard to do, and you know, with the right trampoline, actually, the benefits for the health and beauty are amazing.
And your mood as well.
And you feel like a kid, really.
Yeah, exactly.
You're just bouncing like a bunny, and it puts you in a good mood straight away. And it's just 10 minutes. Everybody has 10 minutes.
You just have to make sure you sit on the Rosella chair first, so your pelvic floor is intact.
I completely agree. I'm going to go with the snackable workout. Gone are the days where I did the 60-minute gym, drove for an hour, went to the shower. I think those days are gone. So for me, it's a 20-minute, when I can fit that in, it has to be 20 minutes. 20 minutes, snackable workouts, high intensity combined with functional. I love good plank, I love a good squat, and I love resistance training. And also when you think about muscle loss, what's attached to muscle? You got bone. So you build more muscle, you build more bone, and you strengthen that. So the two go hand in hand. So 20-minute snackable workout, clear out the alcohol, up the protein, and flush out the toxins. That's really, really key. Anything red, anything pink, and anything brandy, whiskey, prosecco, etc. gone. If you're going to have anything, clean white spirit within reason, and with very little mixers. Also got to be white. And then also lymphatic drainage. I love lymphatic drainage, so we do that manually. And we also use LymphStim, which is a process made from physiotherapy department from BTL, and that just cleans all of the toxins away from the body. The patient sleeps well, they go to the toilet after that, because there's so much tissue fluid that actually sits within the space. And regularity, keeping it up, one-off treatment doesn't do anything. You've got to think of the 6-week cycle, the 12-week cycle, and the tissues do look different. And I think shedding a lot of the things that you don't need in your life, and being really key with what you're eating, as well as moving. You've got to move, you've got to exercise, and I think people just think, can you just stick to the devices? You really just need to improve the microcirculation from top to toe. I love energy-based devices, so we have radio frequency in our clinic. We had a previous device, which is still fantastic. Over the last 9 years of these devices are just getting better. So radio frequency combined with targeted ultrasound. And the latest one is called Axion by BTL, and we have the body by Axion. So that feels lovely. It feels like a hot stone face, like you're being on the beach, and we literally put oil all over the legs, especially over the buttock area. That's a common area. And we're just treating to get you up to a target temperature of 40 to 42 degrees. So you and I will probably be about 33, 34, maybe more, maybe less, depending on the time of the year and where we are. But when we get you up to 40 to 42, that triggers the collagen cascade. So again, we do 6 treatments, once a week, every week, 6 times, maintenance at about 3 months, every 3 months, and that forms new collagen in that area. Collagen not just in the skin, but in the fibrous septate that connects into the deep layers where the muscle are. That's how fat is compartmentalized. So when we lose tissue, when we lose collagen and elastin, if we can tighten it up, everything looks better, as well as with a healthy functioning individual. Does that make sense?
I think you both are
Gino, is that there's nothing left
but
for me
I
to
would
say?
say I like I love the trampoline idea. That's amazing. I think that's quite, and I would go like you said, like a nice short functional workout, something that you really enjoy, and it's just kind of helping you when you're done. So, I can't really add much to that.
These women have a lot to say, and it's all fascinating. So poor Gino on the end, because yes, I totally agree with you. Were there any other questions? Oh no, sorry, that's a no more questions. That was Victoria there. Anyway, thank you, so much for being here this evening. It's been such a pleasure having you, and first and foremost, a big thank you to our amazing Beauty Triangle panel for all of their insights and wisdom. Thank you for everyone who stuck around for the Q&A, and I'm sure the speakers will be here if you do have any more final questions for them. But in the meantime, thank you. We'll see you at the next talk, and have a lovely rest of your evening. Don't forget your green bags. Thank you.
Thank you. Thank you so much.